Hello everybody and welcome to tonight's MHTV. I'm here with my colleague Nicky Lambert, who will introduce herself in a minute. And tonight we're talking about how can nurses best respond to COVID, but also how can nurses respond to other public protection issues as well. So I'm going to hand you over to Nicky, who's covering social media, and then over to our guest for some introductions.
I am. Hello, everybody. Nice to see you guys. What we're going to be talking about today is public health. We're going to be talking about research. We're going to talk about nursing, loads of different things at all. So if there's anything that you want to join in on, any questions you want to ask, anything you don't understand, just let us know. And the quickest way to do that is either comment on the Facebook live feed or go onto Twitter and use the hashtag MHTV, and we'll try and insert your questions as we go. Thank you.
Thank you, Nicky. Okay, Amrit, you've had a really interesting career, so I'm going to let you introduce yourself. I think you do a better job of it than I can.
Hi, everyone. Thanks, first of all, to Nicky and Vanessa for getting me on tonight. My name's Amrit Kaur Purba. Brief background, I was very fortunate to complete my nursing studies degree back in 2016. I then went into health protection for a brief stint, and I'm now currently conducting my PhD in public health. But we can go into a bit more detail slightly later on, but that's just a quick background regarding my career up until now.
Yeah, that's great. And tonight, we were saying that tonight you're here to talk about public health from a variety of perspectives in terms of the research that you've been doing, your work as a nurse, and also some of your background from a broader level, looking at research in nursing and some of the broader opportunities really for nurses. I'm wondering if we should start really with a little bit of an outline of your career today, because I think people who are listening have been really interested. It's only quite recently that we've really seen public health on the agenda, and I think for people listening it would be really good to know a little bit about how you got where you are now, if that's okay.
Perfect. Well, once I completed my nursing studies degree, I was really fortunate to go into community public health, district nursing, and during that time, I then decided to undertake the Masters in Public Health. And this was because, unfortunately, during my undergraduate degree, I was only exposed to public health during one module, which was an optional module at that. And it really did spur my interest in this field, specifically how there's so many different determinants that impact on health and how a lot of these determinants are often put to the side. So after I'd finished my undergraduate degree, when I was working as a community public health nurse, I undertook the Masters in Public Health at the same time. And that was to predominantly gain the skills I would need to conduct robust, transparent and informative research. Following on from that, in terms of my research outputs, I did a piece of work as part of my Masters that was looking at the relationship between organisational stressors in the police force and its relationship to police mental well-being. And this was a systematic review. It was published last year, and I was very fortunate to present this at the International Law Enforcement and Public Health Conference in Toronto, which wouldn't have been possible had I not received support from the Royal College of Nursing Foundation, who actually provided me with an educational grant to attend the conference. And I was very fortunate to also receive input from Public Health England to be able to attend, as I was currently working with them at the time. So following on from that, I actually received an RCN Impact Award because of the work and the reach it actually went to in terms of being able to disseminate the findings to an international audience.
Yeah,
it was most definitely an intimidating experience, to say the least. It was something that I kicked myself over and over again, wondering why I decided to commit to getting a grant to be able to attend, but it was most definitely one of the most beneficial experiences of my career to date. And I think one of the key messages there was I initially thought something was impossible, and I then reached out to other senior nurses in my department, and it was them that put me in touch with various individuals and said, have you tried this? Have you tried this? And I'd exacerbated so many routes to try and ascertain funding, and it essentially ended up being a colleague who worked for the RCN who managed to get my case put forward. I was very lucky, really lucky there. I think it just, I don't know about yourselves, but I think situations like that really just make you feel very humble about the community we can have as nurses in terms of the support we can offer each other, which was great. And following on from that, I was fortunate to secure a role in Public Health England in one of the London health protection teams as a health protection nurse. And that later, I was neglecting for punishment, and I then went into research as lead research nurse for a joint collaborative study with Public Health England and Imperial College, which looked at a group A strep transmission in school and nursery settings. And then I I'd caught the research bug, and I was applied for a studentship at the Medical Research Council's Social and Public Health Science Unit, which I was really fortunate to be granted, and that's what I'm currently doing now. And I think with regards to the COVID-19 pandemic that we've all been faced with, I've been, for the past few months, I've been working to support Public Health Scotland with their COVID-19 response to that. And I think just before we move forward with the conversations today, I just want to highlight that all views are my own, and they won't be affiliated to any organisation I've worked for previously or currently.
Yeah, thank you for that. There's so many questions that I've got to ask you based on what you've just said. I'm not really sure where to start, but I guess what really interests me is, and I guess what I think is an important message for people to listen is that a lot of nurses have imposter syndrome, I would say, particular female nurses. And you've talked yourself there about how you never expected your work to reach an international audience. So first of all, I'm really interested in knowing what tips you've got for nurses, and also what would be your message for nurses who don't feel that they're good enough to get involved in research, who don't feel that they're good enough to do high profile work. What message would you give nurses who are listening tonight?
I would say, first and foremost, don't put barriers in place based on your pre-existing thoughts or pre-existing situations you've been in. I was very much that person wherein I assumed, based on people before me, that things weren't possible. And I think in terms of what I mentioned earlier with the Presidency RCN grant that I got, it's actually just putting yourself out there. It's realising that your education and academic ability that you build on is so crucial to what you do. But you need to use that in combination with actually speaking to other nurses, speaking to other healthcare professionals, seeing what else is out there. And yes, it does involve a bit of work. Don't get me wrong, it doesn't fall in your lap. You need to invest the time, but it's knowing that once you do invest that time, there are outcomes, and they're not that far away. They're just there. It just involves that initial step to take. And it's funny. I think some people always think that the term networking can be quite a cold term, and that you're just using people. But it's not. When I say network, it's seeing how you can help someone, and they then help you, and you bring the skills together. I think that's the way to look at it as a student, especially as we move forward to having more academically trained nurses. When they, for example, when I went into practice, there was always this. It was almost like a conflict between people that had been trained in the hospital and academic nurses. You had the Project 2000 as well, similar sort of idea. And it's realising that you always have something to offer. When you have a mentor that's been in a position for 15 years, I can give an example actually. When I was in my 4th year placement, I had an inspiring mentor, to be fair, and she was very knowledgeable within her areas. But she struggled with revalidation and the documents that needed completed. I was quite good in the computer, but I was terrible at wound management. And collectively, it was seeing how can we help one another. And I think it's that approach and it's that mindset. It's going into a situation and saying, right, I may be a student, but I have something to offer. And with that, you have a bit more confidence in you to say, right, I have something to offer. I have something to bring to the table. How can we help each other? And that's key to anyone, not just student nurses, but to anyone that's starting their career. It's realising that your life is, and this may sound very blasé, but it's something I hold dearly, but your life is 10% opportunity and then 2% what you do with it. I think it's something that students really need to pull into their mindset, especially moving forward especially with the challenging environments that we are facing just now, is to see, right, how can you leverage what you have and use it to its best potential.
Yeah, I totally agree. It's really important. You mentioned mentorship there, and that's so important. If how did you manage to access a mentor? What would be your advice about where to look for a mentor?
So within your placements, obviously you're assigned a mentor, and they're not normally great. But when I started my working role, it was actually a piece of advice someone else said to me. They said, just make sure when you get into the job, try and find someone that's not your manager, maybe an informal mentor. It's also heavily pushed in a lot of organisations, especially in research units, that you have a mentor, just someone that you can speak to informally should you need any guidance. In this situation, I was actually recommended to speak to a certain individual, and I went up to this individual at the first conference that I had, first working for Public Health England. And again, I was terrified, but at the same time, I also didn't realise the level of seniority this person had to create too much nervousness. But I think, as I said, it's just stepping out your comfort zone. It really is. You make that initial step. Yes, it's daunting. It's not the nicest experience, but you've done it, and you can look back and say, had I not had that conversation, where would I be now? I think we put too much emphasis on exams. We put too much emphasis on grades. There's a lot of other things in life that will have a significant effect on your career and your personal life going forward, and it's just actually making that initial contact with someone and reaching out.
Yeah, it's really interesting. Nicky, anything from
No,
you?
I completely agree. And I don't even think it makes so much difference what stage of your career you're at. I mean, you got this sorted as a student. Clearly, you're very smart. I was still faffing around way into my career, absolutely terrified to ask other nurses for help and support, which was really strange, because the minute I asked, everything changed. The minute I said, I don't know how to do this, or can you help me, or I'd really like to write something, people stopped what they were doing. Every stage of my career, when I've asked somebody, they've either said, oh, I'm not the person to help you, but I know who can. And I think it's really interesting that we have this kind of, this negative self-talk, that we just assume that something's not possible, and the limitations are with ourselves. Because I know every time a student has asked me for something, I've hooked them up, connected them, or helped them. And I always think, why didn't you all ask?
Yeah, I agree. I mean, I've never had like one specific mentor. I remember a period where I did look for a particular mentor, and I couldn't find anybody who offered everything that I wanted in one package. So like you've both said, really, I leveraged my sort of social media networks, I would say. And like Nicky, if I've got a particular need, or I'm stuck on something, I always kind of look around and think, right, who's the best person to help me with this? So I think people are willing to help each other, and I love being able to connect with other people as well. If I have a conversation with someone and I think, oh, actually, I know somebody else who'd be really interested in that. I do make the effort to send emails and introduce people. And I think
you've got to create the world that you want to live in, haven't you, really? And I think Amrit was bang on when she was saying, come to the table with something to offer. Because there's a big difference, isn't there, between someone saying, can you give me this, can you give me this, can you give me that, and someone saying, how can I help? One of the things I also need is this. It's very different, isn't it, if you're actually working together than actually just withdrawing. But it's the same thing, isn't it? You see it all the time on shifts and in classrooms. There's always someone who puts their hand up, and the first question is, when do we finish? Like, save that one. Save that one till a couple of people have asked something about the session. But yeah. So getting back to Amrit's career.
Yes. It's fascinating.
I completely agree with everything you both said, and even with Vanessa, what you're saying, we've got social media now. We have at our fingertips. So even if you are slightly apprehensive to engage in one-to-one communication, you have social media as a resource, which is so beneficial now when you consider the different personalities that exist. And it really can cater for everyone. But I don't know, I think it's even after my initial conversation with Nicky, after I spoke to you, I said, you know what? I don't think I'm ever going to not speak to her. Like, you just have, I think when you make that initial contact with someone, you find it on the ground, and that's it. That is it. And I think it's that initial conversation, putting yourself out there. And I think with student nurses, we really need to start being more collective. We need to come together now. We really do, especially at moments like this, during the pandemic, post the pandemic. Now is the time for us to collectively come together and actually have our voices heard. And if we don't actually find a way to come together, nothing's going to change. Personally, I think we really need to have a solid workforce that works together well. And essentially, if we can do that, then I feel like we're winning. We're winning half the battle. To be honest.
Yeah, I think you're right. There's much more focus now, isn't there, on working across the system. Certainly, when I did my training, it was very siloed, and you didn't even speak to somebody in another trust in the same city. Whereas now we've got much more kind of systems approaches to leadership, haven't we? And it's much more encouraged. But I do think that there's still a lot of silos that go on out there in nursing. So I think these conversations are really important, aren't they, for people to see what the potential is. And I think public health-wise, certainly you mentioned Project 2000. That's what I did in the early 90s. And
we're so old.
I know, I'm an old woman. Yes. Well, yes, I am old, Nicky.
I did it too.
Did you do Project 2000 as well?
Yes, I did. I'm just well lit.
Revelation. Yes. Yeah. So, talking public health, I think Project 2000, I don't remember covering public health. And I know when I qualified, I went to work in acute mental health. It wasn't something that I thought about. I've always been very interested in sociology, so I've always been really passionate about inequality, but I didn't link the two. It was much later in my career that I became aware of public health, and I know things are changing, but I guess for people listening, and particularly the Facebook community who might not even be from health circles, how would you describe what public health is and why nurses should get more involved in the public health agenda, and indeed the public as well?
So similar to yourself, Vanessa, I was only offered an optional module in public health during my undergraduate degree, and it was that initial exposure that really captured my interest. And I wish I could just show you. So you've got the Dal Green and Whitehead model of the social.
I'll tweet it.
It really shows well. If anyone's interested in public health, that's the best resource I would say people look at first and foremost. Because it really just shows how you've got the individual and you've got various different personal, family, societal factors that influence the well-being of that individual. And it really does, I think it's something that for me is health. Like we look at all the different factors that help someone function in terms of their bodily functions, their mental functions, etc. And these determinants essentially all link into someone's well-being. So if we can begin to educate people on all of these determinants and the ways in which they can influence someone's well-being, that then allows us to put in appropriate interventions to prevent someone from becoming unwell, to prevent someone from suffering from a long-term condition for periods and periods of time. I think with public health, we need to, but the way in which it's comprised in healthcare is that you've got health protection, you've got health improvement, and then you've got service delivery. And the area of expertise that I went down was health protection. And health protection is considered more reactive work, so you're responding to incidents, whereas you've got health improvement that tends to focus on prevention. So you've got your obesity, etc., that will tend to fall into health improvement. Whereas health protection is looking at infectious diseases, it's looking at chemical, radioactive hazards to health, and major emergencies. So, for an example, health protection would have been, or were heavily involved in handling the reactive response to Grenfell Tower, for example, and that was based on the air pollution factor. And then health protection would be heavily involved in managing infectious diseases. So within the UK, we've got a list of notifiable infectious diseases that by law need to be reported. And need to be recorded on, and then that would then allow a health protection team, say they were notified of a measles case, they would then be able to follow up that measles case, identify all the contacts through contact tracing, then ensure that that individual was given the appropriate treatment or prophylaxis that they would need. So I think that one of the things that was quite, I don't want to say good about the pandemic, but one thing that was good about the Ebola 2014 outbreak, the measles 2018 outbreak, was that it really raised the profile of health protection teams so that people began to become more aware of them. and what they were doing and the specialist expertise that they have and they hold. And I think moving forward, they will, I think, especially post-COVID-19, they will gain an increasing profile. But I think with that, we then need to begin to think about if this is going to be a central focus of healthcare moving forward, as we see threats begin to change from missiles to microbes, we need to make sure our nurses are well placed to be able to handle these incidents. And I think, I don't know if we're going to speak about education going forward, but one of the central messages I communicated in the discussion piece with the Nursing Times was to ensure that we really begin to think about how we can pull health protection training into the nursing curriculum, undergraduate curriculum. And I don't know if you want me to go into a bit more detail now. I'm happy to pick up on it later, but
yeah, I'm happy for us to go straight. Absolutely. And Nicky will probably want to chip into this bit, I'm sure. Yes.
Of course. Do your best, Amrit, and I'll try and jump in.
I'm sure.
I think one of the biggest telltale was, to be perfectly honest, I will be frank, I didn't know health protection teams existed till I applied for the job. That was when I knew what a health protection nurse could do. And it was mind-boggling when I started the role, because I was like, wow, this exists, this speciality exists. But it was also terrifying, because I also realised how little knowledge I had from my undergraduate training to be able to tackle an issue that was actually being dealt with, but was being handled by predominantly nurses and doctors. And I think an interesting thing as well that's quite nice about the health protection teams is that they are multidisciplinary teams. You've got nurses, you've got doctors, you've got biomedical scientists that all come together, and they all collectively contribute to the same cause, and their voices are heard on an equal platform, which is sometimes very rare in healthcare. So I think that's another very interesting thing, is that you have input from different specialties and different professionals from different backgrounds, and then you're out, you see the outcomes that you can produce as a result of that. I think one of the key reasons for bringing health protection training into an undergraduate programme, when we think about the student nurses that have now been deployed to assist with the COVID response, the limitations in their knowledge is now beginning to be surfacing. We can see through surveys, etc., that they feel uncomfortable going into these environments because of the lack of knowledge. And that's just not restricted to student nurses. That's post-registration nurses that are vocalising that. So I think straight away we can see that we need to have student nurses that at a student level and post-registration are able to liaise with health protection teams so that they can assist and facilitate pathogen identification, providing appropriate treatment and preventing further infections. And the only way for us to do this is if there's an investment made in the nursing profession at an undergraduate level to ensure that they have the skills and knowledge on the notifiable infectious diseases that exist, their symptoms, their modes of transmission, how do they break the chain of infection, all of these factors. And I feel that this training shouldn't be reserved for post-registration. It should be something that we should really be thinking about pulling in as soon as possible at an undergraduate level. And when we think about all the mass vaccination campaigns that come to a halt because of COVID-19, we're going to potentially see a rapid increase in the number of other infectious diseases as a result of it, such as measles. And we're going to need nursing support to be able to handle that. And with the anticipated COVID-19 vaccination campaigns, we want nurses to be well placed to lead on the delivery of those campaigns. And we can't expect them to do that without an investment in knowledge. I think, sorry for the long-winded answer, but I think that was one of the key messages that I was communicating in the piece, and it's something that I resonates quite closely to myself, and something that I do feel we should be definitely pushing forward.
Yeah, I think you're right, and I think COVID, one positive about COVID is it's made people much more aware, hasn't it? I mean, I know a few years ago I used to be a lead nurse and have responsibility for infection control across the directorate, and it was very, very difficult, from a practice and leadership point of view, to get people engaged in infection control as an agenda generally, and infection prevention in particular. And I guess now it's on everybody's minds, isn't it? Because of COVID-19, not just nurses, but the public as well. And it'd be quite interesting to see how that's going to shape education and practice, and what people are asking for in terms of their development, and in terms of the public, what the public are asking for. Because I think there's a role of the public, isn't there, as well, to challenge nurses and to challenge the NHS around these issues. And I think in the weeks, months ahead, we're going to be relying on the public as well. I think in terms of, I'm just thinking about my mum, I think I mentioned this in the last week's episode, but my mum travels by bus. And if somebody gets on a bus without a mask, my mum challenges the bus driver, and this is it. We're relying on the public, aren't we? We can't be out there doing everything ourselves, but we're relying on the public, and certainly, from an education point of view, and I know Nicky will want to come in a minute on this, I'm sure. I can really see how it's going to influence the development of education in the future for nurses and mental health nurses as well. We're not just talking about adult nurses here, are we? We're talking about the nursing workforce generally. So before I ramble on any further, Nicky, do you want to come in from an educator's perspective?
I think the things that really are a concern to me at the moment is the fact that the sort of community situation that we're working in is different now. So in the past, I think people, and I don't think it was necessarily better, people would just automatically believe a doctor. They would automatically take on board a message that a professional gave. And I think it's really healthy that people are more questioning now. But I do worry that when we do get a vaccine, I think there's going to be a lot of people who are very anxious about taking vaccines in a way that they weren't maybe 10 years before we had the measles issues. And when I talk about issues, I don't think there's anything wrong with the vaccine. Before somebody was allowed to publish an article that basically killed people. So that's my stance on it. But me, I don't hold back. But I think there's something around the fact that there's so many people now that are kind of tied up in anxiety about safety around vaccinations, who don't necessarily listen straight away to the science. I think that there's a much lower literacy level of understanding around science issues generally. And I have to say, I was saying to you guys before we came on air, I had my first person shout at me in the street for wearing a mask. And I'd seen it on social media, and I was aware that some people were being angry with other people who chose to wear a face mask. But it had never happened to me before, and I was honestly quite taken aback. We did have a chat about it. Neither of us changed our opinion, but I think that's the world we're living in at the moment. And I think it's not just about how do we get health information out, but how do we get people and for people to follow it? It's about how do we get people to believe it? And, how do we make sure that the information that we give is clear and correct?
I think it's difficult. It's difficult to make, I think in terms of belief, I think in order to get someone to believe, they have to believe in the overarching system and the way it works. And unfortunately, there's too many links between different organisations, the government, etc., which creates confusion, I think, for the general public. And I completely agree with what you're saying in terms of the dissemination of information that's understandable to everyone. That's something that I feel we could 100% be really working on right now when we think about individuals with low health literacy, people with no digital literacy at all. When we think about individuals that don't hold English as a first language, for example, we sometimes are really bad in that we see the population as being the exact same. We forget that there's so many different communities that exist. And when I think one of the things I mentioned in the paper is when we think about our district nurses, they're so well placed because they understand their patients. They get given the time to understand their patients. We should be drawing upon district nurses and community nurses to bridge and strengthen the links they have with community institutions, religious groups, because it'll be them that then provides the information to these individuals in a format they can understand. And it'll be these trusted individuals that then disseminate the information to wider communities. And I think one of the biggest lessons learned for myself actually with the 2018 measles outbreak was how effective that strategy is. When you engage with individuals that are within the community, it really does help to reduce the fear and stigma they experience around the issues. And if they've got someone that they feel comfortable talking to, whether that be a nurse or a religious leader or a community leader, those questions don't remain unanswered. They get a response. And I think the more we can answer people's questions in a format they can understand, the closer we are to building that relationship of trust, the closer we are to helping them understand the benefits of vaccination and why they should be considering vaccination. And I think that's something as well that is heavily falls under the remit of health protection as well, in informing individuals of the benefits of vaccination. But again, I don't want to think about to fall too much into this specific topic. But if we think about our, for instance, language translations, we hold, I think 1 in 8 NHS staff hold the non-British nationality. And with that, we have a wealth of resource, and we should be harnessing the talent that exists in the NHS, especially during periods of crisis right now, where we may not have interpreters and translators that are available. So I think one of the suggestions was to create a register of bilingual nurses and other healthcare staff that we can draw upon, not only during periods of crisis, but routine care. And then we can ensure that we are actually putting in place everything we can as a healthcare service to ensure patients understand. And then when they say no, at least we know they understand fully what the answer is and what the information is.
Yeah. I have got a couple of questions that come through. Have a drink, see which ones you fancy answering. So the first one is, big news this week was that Public Health England is facing big changes. What are your thoughts on that? I'm probably quite glad that you work in Scotland, I would imagine. It's one of those thoughts. There's another one saying, Amrit, you said about health protection teams were given higher profile because of Ebola. Did we come to COVID with a well-resourced system? If not, why do you think that was? A bit leading, but I can see where they're going.
Sorry, I missed the end of that one. Sorry.
Yeah, basically they were saying, did we come to COVID with a well-resourced system? Because Ebola went reasonably well for us. So they're saying, did that make a difference?
I think I'll start with the second one, Nicky, and I was fine because I was speaking to someone about this earlier on today. When Ebola happened in 2014, it obviously affected the West Indies. It wasn't it didn't spread internationally. And with that, people weren't affected on a one-to-one basis. Not everyone in the world was affected by it. So when we think about people stimulating change, you tend to have quite a collective response to be able to make action happen. You have to have quite a lot of people affected. I don't want to get into the technicalities of it, but in my own opinion regarding that, I feel that we could have done a lot better. We could have learned a lot more from 2014 Ebola outbreaks. I do think we did put measures in place. We obviously, back in 2004, we had the health protection team that were put in place, and we began to build on that post-Ebola. And I also do think, actually, when we think about the UK as a whole, we are doing reasonably well compared to a lot of other countries in terms of the setup of the health protection teams that we have that exist. I'm obviously trying to now further push that and get more people into health protection work as a priority. So in responding to your question, I think we can always do better. There's always room for improvement. In this instance, I definitely feel we can do better. I think moving forward from COVID-19, I cannot predict what is going to happen, but I can only do what I can in terms of my contribution, and my colleagues are the exact same, and we can only just hope that the efforts we're putting towards this will stimulate long-term action and long-term change. I hope that answers your question.
Yeah, it does. I think it's really difficult, isn't it? Because the uncertainty that we're all in is making people absolutely desperate for answers. But if you don't have the data there, we can learn lessons retrospectively, but we can't really project them necessarily forward until we have more data, some more experience.
Completely, and I think we need to remember as well, evidence informs policy. That's a key thing. Evidence, we can have the research, we can have the evidence, but it informs policy. It doesn't so much create policy. And I think that's key a key factor to remember, that we can have the data, we can have the stats, but again, it's there to inform. It's not to instruct.
Absolutely. And the other question was about Public Health England, and that's, I think, what people maybe don't necessarily understand is how this setup works. So could you explain, because you're in Scotland, are doing something completely different to England, and I think a lot of people forget that.
So within Public Health England, they had their own contact tracing system. And within Public Health Scotland, we have our own NHS Scotland Test and Protect. And the difference between Public Health England and Public Health Scotland, it is something that's very difficult to get your head around. Don't quote me, but my understanding is Public Health England is, well, I know it's an executive body of the Department of Health. Right? It's treated as a civil servant when you work for Public Health England. When you work for Public Health Scotland, it's within the NHS. So,
yeah, and I think a lot of people don't necessarily understand how the NHS works very differently across all the different countries of the UK. And they think that it's just one thing.
It was very difficult, Nicky, it was very unfortunate because when Public Health Scotland came into play, it was at the start of the pandemic. So we never really had the opportunity to explain to the wider population about the changes and what's happening, and that will come with time. But they are very separate systems. In terms of my opinion of what's happening in Public Health England as it stands, all I can say is vouch from all my colleagues that work there and the utmost effort they have been putting into tackling this pandemic and the hours they've been working. And I think at the end of the day, my frustration does lie with the fact that we're going into this blame culture, which is not the right direction. I personally would feel that again, it is usually the outcome of most issues. We do go into that blame culture. But no, my opinion on that is that we can't fall into that trap. We need to remember all the individuals that make up that organisation, every single nurse, every single doctor that has sat and worked to make to protect the wider population. We can't forget them.
I think that's absolutely spot on. I think there's something as well I think about public health, and that because it sits across communities, it's always kind of prey to kind of social factors, political factors in a way that sometimes treatment that's more biomedically based in a weird kind of way, like hospital-based stuff, it's seen very much as a health issue quite separately, whereas things like loneliness, poverty, racism, all those things that impact people's health, they also have a political side to them that's much more apparent for people to see. And so I think a lot of health professionals now are having to get their head around, how do I work across health when health is everywhere now? It's escaped its boundaries. And I think it's a real opportunity, to be honest, but it is going to require us to get our heads in a slightly different place.
Yeah, I think you're right. And we've talked a lot, haven't we, about communities in terms of our own development. We've talked about primary care, and, you know, really interesting what you were saying about having a register so nurses and other healthcare professionals can take on the role of interpreting and helping people, you know, from other cultural groups who don't speak English as a first language to kind of understand and give informed consent. And that makes me think about the fact that, you know, I did some work in the Northwest in primary care, and it was in a community where most of the population spoke Urdu, and a lot of people spoke very little English. And just in the few weeks that I worked with the GP practices there, I learned so much about how they engaged with their communities. And yet we don't take that learning and apply it to somewhere else. We, you know, that kind of developed, I guess, in that area because there was a particular cultural need. But in an area, for example, I live in York, which is predominantly white. We don't take that learning, do we, into other areas. We can't. It's just kind of kept in silos. And I think, you know, we need to, I'm not sure it's a question, but an observation based on what you're saying, that we need to look at how we kind of leverage that learning and share it across the system. And I think primary care has got a particular role to play.
Definitely. I think we do forget how close they get to the time they have. That's something I miss. When I was in community public health nurse, you had that time with your patients. You were never rushed, and it's a blessing in itself. And I think because they have that time to develop those relationships, they begin to, as you said, they begin to almost. When I think about a nurse advocate, I really fundamentally believe we have nurse advocacy will play a role, in tackling health inequalities. But in order to be a nurse advocate, an advocate for your patients, you need to know what you're advocating for. And for instance, when we think about people living with disabilities, 21% of the population, and I was speaking to Nicky about this earlier, when we think about the training that's given to adult nurses, children's nurses, etc. I did not get any training on learning disabilities. I had a 2-week stint in mental health, and that was it. And one of the key things that we've seen with COVID-19 is that people with disabilities have really been left behind. When we think about measures such as self-isolation and social distancing, they've had an impact on the way people can actually access prescriptions, food, etc. And I think this really does just hit home the message that we need to ensure training on physical, mental, intellectual, sensory disabilities spans across all of our nursing programs. Because I mentioned earlier, we've got people that don't speak Old English as a first language, but that's just one of the many vulnerable populations that exist. We've got so many. We've got refugees and migrants, we've got the elderly, we've got, as I said, we've got individuals with various different disabilities. And until we actually start to ensure our nurses understand what the issues are that these individuals are being faced with, we can't expect them to advocate for them. And I think that's the crucial message. Like I was looking through the new standards in the NMC, and it was advocacy was mentioned once or twice, and I popped that in the paper because it really hit home to me that nurse advocacy is the core to a nurse's role. Obviously, we're there, we provide clinical input, we provide public health input, mental health input, but we're so well placed to perform that function in terms of our closeness to patients and also our ability to liaise with other health professionals. So I think one of the key things that we really need to do going forward is to pull that knowledge into undergraduate programs as well. And similar to the register I mentioned about the bilingual nurses, why can't we offer BSL, British Sign Language support, training to nurses at an undergraduate level? Why can't we offer it as an optional, accredited module, or as a CPD activity? And then we build on that register of nurses that can provide that level of support, again, during periods of crisis and during routine care. So I think I know I just keep saying we need to push for more education, but I feel that nurses want that education. I feel that they're wanting that knowledge. And I think now is the best time, to evaluate what we're currently offering and what we need to potentially consider bringing into the programme moving forward.
The other thing that strikes me is how do we work better with charities as the NHS and the voluntary sector? Because surely, charities have got a particular role here at the moment in terms of, their traditional kind of community-based focus, and often, it's the sort of voluntary charity sector that kind of know people and work with communities. And I don't think we're very good, are we, within the NHS at working with charities? We say we are. What's your view on it, Amrit? Have you got any view from a public health perspective?
So when I was writing the piece, I had communications with Inclusion Scotland, and they really did give me a really solid underpinning of, they basically conducted a preliminary survey on people with disabilities in Scotland during the COVID-19 pandemic, and they really pulled out a lot of findings to me that just essentially really did fundamentally structure that piece, because it allowed me to see, right, what's the problem and how do you address it. But that's from a research perspective. In terms of healthcare, I can't really, when I think about the involvement of charities, I can't, and I'll be completely honest, I can't really think of a time that we've had, that I personally liaise with a charity to get support, or had the opportunity to liaise with a charity to get support. And I think that's just based on experience. I think there's so many communication pathways in a healthcare system, so many people to liaise with, so many stakeholders to get input from, that a lot of the time, the NGOs maybe get bypassed and ignored to some degree. I don't know what's your experience, because it's something that I've not really, I guess just my opinion, I've not really been involved in anything.
I think that's the thing for me, because I spent many years working for the NHS, and then when I went independent, I worked more for charities, the independent sector, and it gave me a completely different perspective, and I had no idea, to be honest with you, the work that, and the perspective, much more holistic often than the way that we work in the NHS, and much more kind of human in the way that they work with people. And I I don't think I would have had that insight had I not gone to work with different charities. And I'm just really interested in the last couple of years, really, in how we kind of connect the system up better, because we talk about it, we talk all the time, don't we, about working across the system and, all the rest of it, all the, current buzz terms that you hear, but I'm not sure in reality that we do it very well. I mean, Nicky, from an education point of view, how does it play out in terms of placements and that kind of thing?
It's a challenge, isn't it? I was just thinking, when I first came across Amrit was when you wrote the piece for the Nursing Times, which we've just tweeted out, by the way. So everyone who's watching, please read that. I mean, it's a really good example. I don't want to make you blush now, but it's a really good example of a nurse leveraging their understanding and their skills in a really clear, organised way to help people. Like, here are the problems I'm seeing right now, and here are the things that we can do about it. And it's a really great piece of writing in that it's clear and direct and really timely, because obviously that was the time when everyone was like flailing around going, what are we going to do? It's like, here's what we're going to do and here's what we need to do. And it was great. And I have to say, when I saw it, that's when I started stalking you, Amrit. So I think it's really important that nurses understand the power of their voices. So, the things that you were talking about around skilling nurses up to understand their power, I think I'd really love to hear a little bit more about what you think about that, in terms of, how do you get your voice heard, and what things do you need to think about?
I think, first of all, that piece was, honestly, it was an academic rant to 3 people before I put it in the paper. It was frustration in terms of what I was seeing, and it was just me preemptively seeing how is this going to pan out. And essentially, what was really upsetting is that what I wrote actually began to surface. It began to happen. You began to see it all happening. It began to get reported in the media. And I think if I'm giving a message to any nurses or student nurses right now, it's really, don't undervalue research. Please make time for it. Like, take time to actually understand the journal paper, understand the format. It's not the nicest thing to read, but you will find going forward, it's the thing that you will actually go to anytime you're faced with a scenario. If you want to be able to give a conclusion or a solution to something, you need to draw on something that's evidence-based. And that is where your understanding of research comes in. But to move away from the boring elements of reading papers, the one thing that it really did for me was it gave me the ability to think a lot more critically about what I was doing. Because when you were reading different sources of information, you began to think, wait a minute, what's right here? Why is that person saying that? Why is that person saying that? You dig a bit deeper and you try and come to a conclusion that's actually reached and makes some sense to you. And I think with that, it's quite, I remember actually having a conversation after my undergraduate degree, and I got so excited about research. I'd done my dissertation, and it was, in hindsight, when I look back, it was pathetic, but at the time it was the best thing since sliced bread. And I got really interested in research, and I spoke to a nurse, who went on to do her PhD. And I asked her, because she didn't use her doctor title. And I said, why don't you use your doctor title? And she said, I felt the other nurses didn't really like it. And that was the nail on the head for me. We as nurses really put a limit in place. We do, we put it there, no one else puts it there. We register as a nurse, and we say to ourselves, right, this is it. It's ourselves that put those limitations in based on what we've seen or we've heard. And I think you can be capable of anything. You just need to make sure that you speak to the right individuals. You just keep reading and keep learning and keep exposing yourself to situations that you may not necessarily like, and they may make you feel uncomfortable, but you'll come back. They will come back with clear benefits to yourself. And I know I'm coming across very confident, and whatever I am coming across, but I was a novice nurse, and I still feel like a novice nurse. I still go into rooms every single day feeling like a complete imposter about what I'm talking about, and it's a feeling that will never go away. I think it is just a feeling that you do have, that you constantly want to do better. But I think as nurses, the sky is the limit, and I think you can't let anyone else tell you anything else. You need to just have that in your mind. You can reach what you want to reach. You don't need to stay static at band 5. You can become a band 8. You just need to put time in and the effort, and you'll get there. And I think now it's nice because we're seeing that change. We're seeing nurses going to be senior positions. We're seeing nurses going to academia. They're going into research. I never thought that a studentship would get offered to me as a nurse. If I'm being completely honest, we're seeing things change. So the best bit of advice I can give you is build your networks and build on your ability to think critically, because when you do that, it gives you the opportunity to feel that you've got that voice. So if you can just do, I think that's the best thing. You only feel that you've got a voice when you've actually looked at all the facts, because you're so worried about vocalizing what you feel. So I think that's the best piece of advice. Just keep reading and start to gain a better understanding of research, because moving forward, I think it will begin to be a crucial element of nursing practice as we move forward, especially with health protection and the new threats that we're unfortunately facing.
Yeah, I'm conscious that we're coming to the end, but I think what you've just been saying is really important. And I'm wondering, for people listening, whether you'd have any advice or any resources that you could point nurses towards who are interested in getting involved in research.
In terms of research, well, first of all, my Twitter is there, so if anyone wants to speak with me, I'm more than happy to talk, because I've definitely been tweeting a lot of people to get help in the past. And in terms of resources, I would definitely recommend, obviously, you've got the Queen's Nursing Institute. You've also got your Royal College of Nursing Foundation, and you're obviously the AMC. I would definitely say, if you are in a position where you want to do further education, or you want to perhaps do a course that you may not have funding for, there's various different people you can reach out to. You've also got the Churchill's Institute, and you've also got the foundation I applied to. So the Royal College of Nursing Foundation offers a variety of grants, educational grants, support grants, etc. And it's essentially just putting down a proposal as to why you want it, how it can benefit your practice and your development going forward, and what you feel you would get out of it. It's not a tiresome process. It just involves you taking a bit of time to write that down. We have openings all the time, but again, Google can be a godsend sometimes. Honestly, if you type in nursing support, nursing funding, a lot of things will come up, and it's just a case of putting in a bit of additional effort, but you will find something. And again, if you don't find it online, speak to the nurses that you work with, or even reach out to nurses in the area that you want to perhaps do a bit of research in and get their opinion. Because as I said, the thing that worked for me, and the thing that I feel has really contributed to any output I've managed to produce, has been the conversations I've had with the nurses that I've worked with and the health professionals that I've worked with. It's been them, it's been their introductions, it's been their support, it's been their knowledge that has really helped me to build the confidence, first of all, to actually want to be able to vocalise my opinions and feel that they can be put on paper. So for any nurse, I definitely say, academics are important, but think about the people you're working with and the people that you want to work with, and bridge those relationships and keep working on them.
Yeah, great. Nicky, any before we finish? I'm conscious, I know we've had such a fascinating conversation and we've covered some, and I can't believe that we're coming to the end already. So I just want to squeeze any final comments in from Nicky or from coming on social media before we finish.
Yeah, we did have one question in under the line. So what are Amrit's views about making sure health warnings are spread to all ethnic backgrounds, and what improvements would she recommend or suggest? So you did touch on that a little bit, but you could also come back, and it looks like that's on Facebook Live, so you could always comment on that later if you wanted to. Yeah, I'll email it to you so you have it.
If I would advise to read the paper, because the paper really does answer that question well, in terms, because that was one of the primary focuses, was how can accessible information is provided to everyone.
Brilliant. So the paper has been tweeted out under the hashtag MHTV. Please read that. And also you can follow us back and ask any questions if we haven't got round to anything. But for me, I think what I've really taken from this session that I absolutely loved is what Amrit was saying about, I knew something was wrong, I felt something was wrong, I was having this furious argument, and then it turned into a really important article that obviously tons of people have read, and then you never know the impact that you will have on somebody else when you write something like that. But also, as a reader of other people's work and other people's nursing knowledge, but celebrate it. You know, I think there's nothing other than, you know, the story you were saying about the nurse who achieved a doctorate and then felt embarrassed to say that. You know, when my friends are doctors, I call them doctor all the time. I love it, because when one of us rises, we all rise. You know, and when our knowledge is enriched and we create learning and nursing theory and nursing knowledge, it only benefits everybody. So for me, there's something about being a really good colleague, you know, and not just pretending to read your friends' articles, blogs, but actually doing it, retweeting it, thanking people, all that kind of stuff. You know, celebrate each other. It's a really good thing.
Yeah. I mean, I think for me, obviously, you know, I've learned a lot about, you know, the work that you're doing, and particularly, you know, around COVID. But I think, like Nicky, you know, some broader reflections really about, you know, you've had a really inspiring journey and you've done some really amazing things, but you've also made it seem really accessible as well. And I think, you know, for nurses listening, the importance of the fact that, you know, we've all got a voice and we need to use it, and we need to all be contributing to research and, you know, driving nursing forward and, you know, having a place at the table, so to speak. And the importance, which Nicky's alluded to just now as well, of us all working together really, and, you know, breaking down this kind of competitive kind of element that can happen sometimes in nursing and across professions, and us all working together more collaboratively and thinking about, you know, what we can achieve together if we're able to do that. I think it's really important. So yeah, I mean, it's been great. I've learned so much tonight, and I kind of sense that the conversation might continue as well. You know, and it'll be great, you know, if we can share the links and, you know, encourage further conversation, I think, and hopefully inspire some people to think about, you know, moving into that kind of research space and public health. That would be really great. And I think on that note, Amrit, do you want to have any final comments from you before we finish?
No, just thank you very much for the opportunity to speak. And I guess just as Nicky and you both just said, we need to do this together. We need to support each other. I think that's key right now. We're really well placed to move forward right now. I think if we can actually just bring that together, and again, I mentioned networking, but we've got social media now, so we can all do it. We really can. We've got no excuse. And on that note, as I said, my Twitter's there, so if anyone wants to speak about anything, or they want a bit more information, or if they want a bit more support, I'm more than happy to respond, and I'll get back to them as soon as possible.
That's okay, great. Looks like we're ready to finish then.
Thank you, and we'll be back next time. Good night, everybody.
Bye-bye. Bye. Thank you, everyone.
Bye.